What is GnRH agonism in transgender puberty blockers? Have you ever wondered how some young people can pause their puberty? This is where gonadotropin-releasing hormone agonism comes into play, especially for transgender and gender-diverse youth. These medications are known as puberty blockers, and they play a vital role in gender-affirming care. Gonadotropin-releasing hormone is a hormone made in the brain. It usually tells the pituitary gland to release two important hormones, luteinizing hormone and follicle-stimulating hormone. These hormones then signal the gonads, which are the testes in those assigned male at birth and the ovaries in those assigned female at birth, to produce sex hormones like testosterone and estrogen. When gonadotropin-releasing hormone agonists are given, they initially stimulate the receptors for gonadotropin-releasing hormone. However, if these medications are used continuously, they actually turn off the signaling pathway. This means that the releases of luteinizing hormone and follicle-stimulating hormone decreases significantly. As a result, the levels of sex hormones drop, effectively pausing the physical changes associated with puberty. For transgender youth, starting these medications at the beginning of puberty can be incredibly helpful. It prevents the development of secondary sex characteristics that may cause distress. For example, individuals assigned male at birth can avoid changes like a deepening voice and facial hair growth. Those assigned female at birth can stop breast development and menstruation. This pause allows young people to explore their gender identity without the added stress of unwanted physical changes. One of the great things about gonadotropin-releasing hormone agonists is that their effects are reversible. If a person stops taking the medication, puberty will resume. This reversibility is essential because it allows young people and their healthcare teams to make informed decisions about further gender-affirming treatments. Research shows that puberty blockers can lead to improved mental health outcomes. Many young people experience reduced anxiety and depression when they can pause their physical development. Additionally, using puberty blockers can make future hormone therapies more effective and satisfying. Gonadotropin-releasing hormone agonists have been safely used for decades. They were initially developed to treat early-onset puberty in children, regardless of gender identity. Their use in transgender healthcare began in the early 1990s and is now recognized as a standard intervention by leading health organizations when used appropriately. In summary, gonadotropin-releasing hormone agonism in transgender puberty blockers involves using medications that suppress the hormonal signals that trigger puberty. This process delays unwanted physical changes and supports the mental well-being of transgender youth during a critical time in their development.